Welcome to the KBlend Show. Honest conversations about God, mental health, and chronic pain. Without masks, without pretending, and without fake smiles. Here are your hosts, John and Krista Klyder.
Thank you so much for joining us today on the KBlend Show. I am Dr. Krista Klyder, and I'm your host for today. And I am joined by our friends and our guests, Leroy and Susan. Thank you so much for being here today to share your story.
Thank you.
You're so welcome.
So who are we? As many of our listeners might remember, KBlend, we are no strangers to WMUZ. We've actually been advertising partners for several years on WMUZ now, and we are very excited to be here today on our new KBlend show, where we are sharing about mental health, chronic pain. We're going to be hearing real testimony from real patients about how the KBlend program has helped them overcome everything from depression to anxieties to suicidal ideations, PTSD, OCD, and again, all sorts of chronic pain syndromes from arthritis to migraines to back problems. We're going to hear their testimonies live. And so who am I? I am actually a psychiatric mental health nurse practitioner, as well as a certified registered nurse anesthetist. And we are your resource. We are your resource for those of you who know someone, or maybe you yourself, you're struggling with similar conditions. And so I hope that you listen to us for the next hour or so on this KBlend show. Now, if you're interested in also watching the video feed of this show, please go to www.mykblend, that's MYKBlend.com, www.mykblend.com, and you can watch the video feed. So, Susan, tell us a little bit about what you were experiencing before you came to KBlend.
I was wrestling with depression and anxiety from some trauma that happened to me in my home, and wasn't able to get over a lot of that. And I had previously had strokes, and so for me to process something, I had a very difficult time processing, so that I really needed help because my brain wasn't functioning like I needed it to get through what had happened to me.
And what made you finally decide to reach out to KBlend? What was the ultimate deciding factor there?
A friend of mine had gone through the treatments, and his wife's my best friend, and she said, Sue, you need to talk to Jesse. And so I talked to Jesse about what he experienced from doing the KBlend. And my husband finally said, Sue, I really think you need to try it. And I'll tell you what, the third time that I had it done, I went in, and my mother, who was 90 years old, looked at me after I came in after a treatment, and I was just chitter-chatting all over the place. And my mom said, you are back. And so she noticed the difference in my cognitive ability to think clearly. And she saw me walking, and after I had the strokes, I was literally, I would drag my foot, and my balance was off and everything. And after I had some treatments, I got back a lot of my balance, but my cognitive processing and everything, it was back. Mm-hmm. And it's so hard to believe that something as easy as this could actually address it. You will get to the place where you can get healed. And it's amazing.
That's amazing. Thank you so much for sharing that. Now, share with us a little bit about what things are you able to do now that you weren't able to do before KBlend?
I was really struggling with being able to do just simple like housework, and being able to cognitively put everything in order so that I could accomplish it. And after I had some of the treatments, I was able to go home and literally process it through the brain. You would think that you would be able to do stuff and to be able to look like you're organized and have things cleaned up and have things done right. But with having a cognitive, it's just like all sorts of roadblocks in your way mentally to be able to take the plates and set them on the table, and then to take them from the table back and clean them off in the kitchen. And just little functions are difficult to do when you've had a stroke, when you've had your cognition knocked out of the way. I mean, not only did I have to learn how to respell and redo all that stuff, but you actually have to go through the traditional things that we know on how to function with other human beings, how to talk to them, know when to talk to them, and all that stuff. Don't always get everything back when you've had a stroke. You've got to resurface, like you have to resurface all your social abilities. A lot of people don't understand and just take you for being quirky, but you've got to get the processing back when you've had strokes. And there is not much out there available.
Well, you are definitely amazing, because I remember the first time that you came in, and I remember your leg especially was very troublesome
Messed
to
up.
you.
Yeah.
I remember that you were walking and dragging your leg because you weren't able to really pick it up. And I do remember, I think it was probably on your third treatment or so, you were actually able to pick your leg up. And I remember you showing me that. You were so excited. Do you remember that moment?
Yes. My balance, if you look at a stork, how they have one leg picked up, that functioned for me after I had strokes was an absolute impossibility, because I would just pick the leg up and totter and fall over. And that's a main function. That had to do with me walking too, and big difference.
Mm-hmm. And so share with us a little bit about your depression and your anxiety as you went through the KBlend program, how that also changed, because we know that people with chronic pain syndromes, that they're more likely to have depression and anxiety. There's actually about a 40% chance that patients with chronic pain syndromes, whether it's, something as, quote, benign as arthritis to crippling as complex regional pain syndrome, you're more likely to have depression and anxiety. So how did those get affected as you went through the KBlend program?
Your mental capacity and your emotional capacity are all intertwined. Everything is intertwined. So if you're not able to do something, that affects you mentally, but that also interferes with your cognition. This has treated not only the cognitive aspects, but has helped me with the depression, has helped me with the anxiety. It makes such a big difference. I can literally think, process it, and apply it, and actually do it. Even though I do have interferences now, but it's still the ability to pick it up and do it is there. Big difference.
Big difference, absolutely.
Yeah.
So how does your husband feel about you going through the KBlend program? What changes has he noticed?
Oh, he noticed from day one. He noticed everything. I didn't think he noticed everything, but he noticed everything. And my mom, she might be 90, but she doesn't miss anything. She says, my body's failing, but my mind is there. And I'm like, I know, I see it. But it's a big difference. Everybody notices. Even people at church, they say, you look so different. It makes a big difference when your brain works.
Absolutely. And my husband, John, and I, we've been running the KBlend program for over 5 years, and we have treated hundreds of patients with mood disorders and chronic pain syndromes. You've heard the amazing testimony of Susan, and we have lots more to share here coming up. But I want you to know that if you are someone who's suffering much like Susan was suffering before the KBlend program, please give us a call, 734-605-8500. Again, that's 734-605-8500, or visit us at www.mykblend, that's the letter K, BLEND.com. We'll be back in just a few minutes with more to share.
7 months ago, I had plans to kill myself about 3 times in that month.
Scott had been dealing with anxiety, depression, and suicidal ideation for over 50 years. Then he found out about KBlend.
My best buddy got me into KBlend, and I told him, there's no way you can fix me. I'm unfixable. And John and Krista assured me that they can help me.
John and Krista Klyder of KBlend use their proprietary and highly personalized ketamine infusion plan to work like a sledgehammer to break the chains of bondage to anxiety, depression, suicidal ideation, PTSD, and other mood disorders. Call the KBlend Helpline at 734-605-8500.
My experience with KBlend, such a loving environment, just fantastic.
KBlend can help you too. Call the KBlend Helpline at 734-605-8500.
Welcome back to the KBlend Show. I'm Dr. Krista Klyder, your host for today. And again, my guests today are Susan and Leroy. We just heard some amazing testimony from Susan. Thank you again so much for sharing. And now we're going to hit Leroy up. So Leroy, tell us what you were like before KBlend.
3 years ago, I had to have knee replacement. After I worked as a contractor, I wasn't able to get down to the ground and pick up things. And kneeling on the floor, it wasn't happening. John was talking about it, and I figured I'd try it. And also I went to a chiropractor, and the chiropractor took x-rays and said I'm full of arthritis. My hands, I couldn't grip hardly, and that was causing my pain in my joints. I started the treatments. Now, just one treatment doesn't do it. People think, oh, you do one treatment. And it took years to get the arthritis in there, and ever since I've been doing it about once a month, and I feel so much better. I used to get out of bed in the morning with a hunchback until I got a shower and straighten out, and now I can get up and I don't have the hunchback, which made me feel so much better.
Yeah.
Yeah.
Are you able to bend over and pick things up now and work okay, and you're high functioning?
Yeah, some of my people say, how did you do that with all your problems? And I said, I can do it now.
Wow. Amazing. Okay. How's your wife feel about you going through the KBlend program?
Oh, she thinks it's great because I'm able to do a lot of things. I've been trying to get her to come in, but she doesn't. I don't know why, but I can't get her to come in.
Okay.
But I know she had one vitamin treatment, which is great because I get vitamins when I do my treatments, and it makes me feel better, and it actually, I don't have a cold as like I used to.
Yeah, amazing when you get that good nutrition in your body. So your arthritis now, so your joints are moving better, you're able to do things. Are you able to go long distances like in your car without your back hurting, your knee hurting, your hands hurting?
Absolutely. And the only thing I do have, if I walk a long distance, that's when it starts, but I understand that. But mainly ordinary life, I don't have any problems going to the grocery store and doing anything.
And I think it's important for the listeners to recognize that one treatment is not going to change you into the Superman that you want to be, right?
Yeah.
So it's not that miracle drug, the one pill that you take and then all of a sudden you're the person that you've always wanted to be. It does not work like that. This is a process for sure that your body adjusts and your body is healing. And so little by little, it doesn't cure per se the arthritis in your body, but what it is able to do, the KBlend program, is that we're able to change the way that your brain perceives those pain signals. And that's how your pain starts to improve. And so you feel that inflammation decreasing in your body from the treatments, but then your brain is also quieting all of those pain signals that it's receiving. So it's an amazing process for sure. And you guys are living testimonies of what KBlend can do. Susan, let's go back to you for a moment. You've been through several traumas you had mentioned in your life. And do you feel that your fear, your reaction to stress, that your response has changed with the KBlend treatments?
Yes, it's hard to put your finger on it.
Mm-hmm.
The urgency or the trauma or feeling like you're mentally breaking up because you can't handle the traumas. It's a lot easier to be calm about it rather than get all stressed out. So it definitely does make a difference. But just the other day, I noticed that I need to go in and have another treatment because I'm getting a little on the edge and all that. So after the initial treatments that I have had done, I'm going to just have to schedule some treatments so that I can stay up with it rather than be behind, and just as a maintenance. So that I can stay on the right track.
And, it's better to have that scheduled than it is to wait until you get into crisis mode, right?
Oh, yeah.
You don't want to be spiraling and out of control when coming in because you want to make sure that you stay on top of your mental health and your chronic pain for sure. Leroy, has there been any changes with your mood? I know that you don't have any depression or anxiety, but have you noticed that maybe you see things a little differently? You're more accepting of things, that maybe you're more patient, you think things through a little bit easier, anything like that?
Well, matter of fact, one of my workers of mine, Mike, he was telling me the other day, whenever I take a treatment, it seems like I'm a different person. He comes in and I'm happier. I'm doing things like, he said, and he's 10 years younger than me, and he's talking about, I can't keep up with you. So that's fantastic for me.
Yeah, that's amazing. So if you wanted to say, Leroy, anything to the listeners out there who are hearing what you're saying, but they're like, oh, this has to be too good to be true. I've never heard of the KBlend program before. Where is this coming from? Is this make-believe? Is this just a story? Are these paid actors? What would you say to somebody listening right now?
I'm not a paid actor. But no, it's if you have the arthritis pain, and you're always hunched over or having hands cracking, and you need to actually come and get a treatment. And as I say, the first treatment is going to be one thing, but you need to do 2 or 3 in a row in order to start seeing your arthritis going away. You're able to walk better and things like that.
Mm-hmm. And we treat all sorts of pain conditions, from back pain, neck pain, to fibromyalgia, to also migraines, to complex regional pain syndrome. There are many, many different types of pain syndromes out there. Trigeminal neuralgia is a big one for us. Oh, go ahead, Susan.
Yes. I had a migraine headache, and I had a treatment scheduled, and I thought, I'm going to call her up to make sure that it will work with me having a migraine in that. I get severe migraines where you have to close the curtains and get in a black room and that. And after I had the treatment, oh my gosh, I don't think anybody could believe it unless they try it. What you did, it's amazing. Yeah. It's amazing. I'm usually out for 3 days with the migraine. And after I had it done, by that evening, all the migraine was gone. I mean, if any of you out there have migraine medicine, you know what I'm talking about. You're out for 3 days. And I went in with almost a full migraine. Mm-hmm. And it affects my vision. It affects the light coming at me and everything. And I even took my glasses off outside, and I could handle it. This sounds like a dream, but you're out here, and this can help someone with medical problems. Big time. even with the pain, I have had success with the pain. I've done a pain and I have severe arthritis in my back. It's amazing.
That's amazing. Thank you for sharing all that. I remember when you came in for that migraine too. When I get a migraine, I get that nausea that lasts for 2 to 3 days after. Did you experience that after you had that treatment?
No, I was able to eat.
Wow.
And is usually if I have a migraine, I eat. If I eat anything, it's going to be soup, not with food, but soup and maybe tea, no hard food. I went to my favorite place, A&W, afterwards and actually ate something, and I did not throw it up.
Wow.
So it was like, this is a good call.
Yeah.
For a migraine, and it's amazing.
Yeah, that is amazing. So if you are suffering from migraines or arthritis or, again, any of the chronic pain syndromes, please give us a call and let us know if you have any questions, if you would like more information. There's no obligation. Give us a call at 734-605-8500. Again, our phone number is 734-605-8500. We're really looking forward to hearing from you. You can also visit our website at www.mykblend. That's MY, the letter K, BLEND.com. Please contact us. We'll be back in just a few minutes with more amazing testimonials.
This is Nate talking about his KBlend success on the Home and Health Show.
3 weeks ago, I would have been sitting here, I'd have been fidgety and not been able to speak clearly. Now I feel like I could face the world. The fears are gone, like the chains are broke.
Nate had tried just about everything to get his depression and anxiety under control, but the medications and therapy weren't working. Then he tried KBlend. Proprietary KBlend acts like a sledgehammer on treatment-resistant mood disorders like anxiety, depression, PTSD, OCD, even chronic pain.
If you tried everything else, why not try this? You went down that path before, why not go down this one?
Call the KBlend helpline at 734-605-8500 and talk with the KBlend experts about how this miraculous treatment can break the chains of your mood disorder or chronic pain.
If there's a light at the end of the tunnel for me, I know there's a light at the tunnel for others.
Call 734-605-8500. Call the KBlend helpline at 734-605-8500 and talk with the KBlend experts.
Thank you so much for joining us again on the KBlend Show. I'm Dr. Krista Klyder, your host for today, joined by my friends and guests, Susan and Leroy. We've heard amazing testimonials from both of you now about how KBlend has positively affected and changed your lives. And Susan, you were just sharing with us on that quick minute break that with the KBlend treatments, you noticed a change immediately with your first infusion. Please share a little bit more about that.
Immediately. I couldn't believe it. I couldn't believe it after I had the first one. I came out and went, Ken, I cannot. I've done everything from acupuncture to blood irradiation, all sorts of stuff. But this is the only thing, the first day that I had it done, there was just such a remarkable difference for me. But I was kind of messed up. Having continual stroke and all that, my cognitive ability wasn't there. But the first day, I felt the fog starting to clear. And I had more energy, and my brain was mentally able to function. It's a good thing because you can put on makeup and you can look really good, but when you open your mouth, have difficulties after having strokes and things, you notice a big difference after. And I was so anxious to come the second time, but I was like, okay, I feel so good now. When can I have the next one? And I'm like, am I supposed to wait or am I supposed to just go on? And that's where you guys come in. You know what you're doing. You know how to set people up for success. And if you follow the successes, if you follow someone who knows what they're doing, the successes are coming. I noticed such a difference with each one that I had done.
And you bring up a really good point that, there are other clinics out there that try to mimic the KBlend program, but we are very unique in our situation with my husband, John, and I running this program. We are very hands-on with each and every patient, making sure that you get the results and the treatments that you need. And I get to know you extremely well. So I know things about your life. You know things about my life. We have a very intimate relationship as a provider and patient, correct? What was your first experience when you first encountered John and I? What was that like?
I have a gift of reading people, but when I came in and met you and met John, I had such a peace about it. And you don't normally get that with people that are working with the medical field. I not only have done the treatments, but I've also done counseling with you. And the counseling is so sound, and the compassion that you guys give anybody who comes in is way beyond what you would get from normal people that are in the medical field. And the amount of comfort that I had with the traumas that I've had, that's pretty hard for me. It was really hard for me to trust people, but I just had a perfect peace about talking to you, talking to John, and feeling comfortable. And with some of the stuff that I've had done to me, it was hard to trust. But with you guys, it's different. It's different.
So we can't take any credit for that. that would be coming through our love for Jesus, right? And being the broken vessels that we are, trying to be his hands and feet. My husband and I don't see this clinic as a job. It's actually our calling. It's where God has placed us. We knew that it took us 2 years to build our first location, and we opened in the middle of COVID. And it was just crazy. Everybody said to us, why are you doing that? How can you do that? Why would you do that? This is COVID. We're in this major crisis right now. And our response continuously was, because this is what people need. Our mental health is declining in America, and we can do something about it. We can help people with mental health disorders and chronic pain syndromes like never before. And, my experience in the world of anesthesia, and now my experience in psychiatry, we've perfected our program where patients are seeing you're walking miracles, really. I mean, Leroy, you run your own business, and where would you be if you couldn't function at the level that you're functioning now?
We'll do it. I would have to sell it all because first thing is, not nowadays you can't get anybody to work, so you have to do it yourself.
Yeah.
So I'm able to do the work myself. And
that would be tragic in your life if you had to sell, because your business was your life work. You've spent years building that up. And, again, this is our ministry. And I think that's why John and I have the energy to put endless hours into what we do here at the clinic, because we're passionate about it. And it's so rewarding for us to know that we're able to help you and give you the results that you're getting. And so just thank you so much for sharing today, because I pray that there's somebody in the audience that's listening right now that's struggling, who can hear what you're saying, that the KBlend program works, that it can be transformative, and that it can literally save your life and change your life. Susan, do you want to add something? You look like you're chomping at the bit there.
You need to pick up the phone and talk to them, and to put some action behind, and take a step forward. Try it. Makes a big difference.
One of our good friends who helped us build the first clinic, his name was Jack, and he used to call it the 1,000-pound telephone. It was so easy to think about something, to hear something, to try to process it, but when you actually had to take that action, man, that telephone feels like 1,000 pounds.
Ask God to help you to do it.
That's right.
Because it makes a big difference.
That's right.
And you will be rewarded for doing it personally, because you'll be able to function. Yeah.
if anything else, it's the ideal is even the vitamins. Just doing a vitamin treatment makes you feel a lot better, and getting all the vitamins that you need.
Absolutely. And we offer several different vitamin drips at our clinic, everything from B12 to the whole B complex to high dose vitamin C to glutathione. We offer all of those, and absolutely they're amazing. And we use those in our KBlend program as a blend to not only use our main treatment option, but also the vitamin drips and then also the psychotherapy, Susan, that you mentioned. Now, where does your main support system come from? Your husband, your mom? How do you cope from day to day now that you've completed, Susan, several KBlend treatments? How are you continuing to move forward in your life between your treatments that you get at KBlend?
Praying and doing God's word, reading the Bible. And if I need help, I either make a phone call or I talk to my husband and go to church and access people that I have at church.
That's wonderful. So now that you're doing so much better, you're obviously very well composed with your speech. I can see that your brain is fully functioning. You're answering these questions on the fly. There's no script here. There's nothing in front of us that we're reading off of.
I couldn't do that before I had treatments. I wouldn't have been able to sit here and answer questions. A lot of times I would have to wait 3 weeks to get an answer for a question. Nobody knew what was going on. Nobody knew I was having the cognitive problems.
Wow.
It's kind of hard.
Yeah. So you were you had perfected putting the mask on.
Oh, real good at putting the mask on.
Yeah.
Yeah.
Yeah. So when you went to social functions, did you go to social functions before the KBlend program?
Yes, I did, but I would keep my mouth shut and not talk much.
Okay.
But I would have people coming to me for counseling or for other stuff, but it was very, very hard to do.
Leroy, you do some pretty complicated work too as a contractor. Do you feel like that your ability to work through and problem solve for some of those plumbing projects or building projects, has that gotten a little easier?
Oh yeah, I'm very good at figuring out problems.
Okay.
And if I can't figure it out right there, just let me go to sleep one night, and the next morning I know what I can do.
Okay.
And straighten out problems.
Okay.
But as I say, you never get angry at stuff. That's the one thing a lot of people do. They just get angry, but you don't do that.
Did either of you ever question God or get angry with God about why is my body failing me? Why can't I do these things anymore? Did you struggle with the aging process? Because we're all getting older. Me too. I'm included in this. You know, did you ever have questions or fears about what you were going through?
Well, when I started going through the trauma stuff that I was going through, I did at a few points in times think about just leaving, but I couldn't. I have a 90-year-old mom I'm taking care of, but it just got, the stress just got so great that I just wanted to leave and not come back.
So it's not that necessarily you wanted to die, but you wanted the pain to stop.
Well, when you go through trauma, you do think about killing yourself.
Sure.
I'm human. The thought went through my mind, but I told it to take a hike because that's not the way I wanted to handle it.
Right.
And when Jesse came up with, Sue, you need to try this. You need to try this. I got such a peace after I did it, and it just calmed me down and this and that. And I thought, I'm going to try it.
Yeah. You know, you bring up such a really good point, is that trauma is trauma. And as we process our way through it, the good and the bad surfaces about it, right?
Good, bad, and ugly.
Right.
Yeah.
Absolutely. Oftentimes, our patients who go through trauma, they specifically seek out KBlend just because they need to process their way through it. And sometimes the trauma, it goes up, down, and all around in our brains, and we can't get rid of it no matter how hard we try. We're stuck in that thought process, that mental loop where it's reoccurring.
It's repetitive.
It's a repetitive day in and day out.
It comes back over and over and over again, and it's like you cannot break it. You have chains at your display.
Yeah.
That is what I felt.
Yeah.
I felt like I was tied down.
Yeah. Yeah.
And couldn't get off the loop.
Yeah. I remember when we went through a very big trauma in our life a few years ago, I used to pray, God, take this away from me for one day. I don't want to think about it. One day, please, just remove it from my brain for one day. And day after day after day, it was still there. And finally, praise God, one day I went a day without thinking about it. But the next day I thought, oh, I didn't think about it yesterday. And I was like so shocked. That was shocking to me. I couldn't believe the weight that had lifted off my shoulders. So that those repetitive thoughts, that mental loop that you get stuck in, and you talk about chains, and we have on our backdrop here, our listeners, you can't see unless you go to our website to view this video stream at www.mykblend.com, but we have chains on our backdrop even, and a big explosion right between Susan and I. And that's because what we say here at the KBlend program is that we break the chains of mental health and also of chronic pain syndromes. You don't have to live bound anymore. You don't have to let those diagnoses define who you are, to hold you down, to tie you up like you, Leroy. Like you didn't have to let that arthritis ruin your career, ruin your life's work. So please give us a call. 734-605-8500. Again, 734-605-8500. We are here to help you. There's no obligation. Call us and talk to us. Give us your story. We are here to listen to you, and we will let you know if KBlend is right for you. That's 734-605-8500. We'll be back here in just a few minutes with more amazing testimonials from Susan and Leroy.
Joey was dealing with several issues when he first came to KBlend.
Trauma, anxiety, depression, failure, hopeless, not knowing even where I stood with God.
He tried the conventional ways of dealing with his anxiety and other mood disorders.
I did therapy and counseling. I seen a psychiatrist. They prescribed me medications. The medications, in a way they helped, in a way they caused other problems.
Nothing he tried was helping.
After so many failed attempts, you start to feel hopeless and you feel like nothing works.
And then Joey went to KBlend for their proprietary and personalized treatment of anxiety, depression, PTSD, OCD, and other mood disorders, and he finally had his breakthrough. Take a sledgehammer to your treatment-resistant mood disorders and pain with KBlend. Call 734-605-8500 and get on the road to true recovery. And Joey's advice to others who are searching for relief?
I would tell them that whatever they're struggling with, they need to bring it to KBlend.
I didn't get out of bed some days. My friends didn't even know anything about me for months because, I just didn't want to talk to anybody.
For years, Jill tried almost everything to conquer her depression and anxiety, but nothing seemed to work.
I've been going to therapy since I was 13. Every medication you can think of, I've done a mouth swab test to see which medications I'm good with. It was 3, but we tried all 3 and nothing worked. And hence the KBlend, because that was the last resort. And let me tell you, I'm so thankful it worked.
KBlend acts like a sledgehammer on treatment-resistant mood disorders like depression, anxiety, PTSD, OCD, even chronic pain. Call the KBlend Helpline at 734-605-8500 and talk to a KBlend expert about how this revolutionary program can help you overcome your treatment-resistant mood disorder, suicidal ideation, or chronic pain.
What else do you have to lose? Just do it.
Tuning back into the KBlend show, I'm Dr. Krista Klyder, joined by my friend and guests, our friends and guests, Susan and Leroy. Thank you again for being here today to share your testimony. Now, we have really two extremes on the pain spectrum. Leroy, you have arthritis. You were still functioning, not at a very high capacity, but still functioning. And then we have Susan. You have several issues with pain, from your back to migraines, your foot that you were having difficulty with after the strokes. And yet we've been able to help from the least severe to the most severe, per se, right?
Yes.
Now, do you think that when should someone call KBlend if you were to give them advice and say, oh, you should wait until you're having difficulty and you're thinking about selling your business, or should you wait until, you're having trouble taking care of your 90-year-old mother? When should someone call KBlend? When is the right time?
Before you get into a lot of trouble. Catching up and getting back to normal is a lot harder than when you see it start to appear. If you start earlier, you're always ahead. And the nice thing about the KBlend, your KBlend isn't only ketamine. Mm-hmm. It is also sound therapy, which joining them together, it gives you a peace. So I would say get it before it goes bad, because then you can get it contained and maintained.
That's right. And there's less physical damage to your body if you catch it earlier. The sooner you can get in. So for example, the arthritis, the sooner we can start treating that, the less damage to your joints. The sooner that we can start treating, for, as you talked about, the results that you had after your strokes.
Yes.
You have to be the right candidate, and that's what we'll walk through when you give us a call at 734-605-8500. We'll go through with you whether you're a candidate or not for the program, but there's no obligation to call. There's no reason to not call. You need to call us so that way we can go through exactly where you're at on that spectrum and whether or not KBlend would be right for you.
Also, you have to look at, if you're working, you're already starting to have the pain before you retire. And if you're starting to have the pain when you're working, you have arthritis. But you need to actually start doing something then instead of waiting till you are retired. And then you have a lot of problems. And it takes longer to get rid of those aches and pains.
Right.
I went to my neurologist and I said, I've been doing ketamine treatments. And he said, keep them up. You need them. With what's going on in your brain right now, you need those treatments. And he said, so please go. And so that was a regular neurologist.
Yeah.
And he's the one who's following me after I had the strokes and things. And he was like, go, get it done. He said, that will help you so much. And so I have doctors that are pushing me to do it.
Yeah. What did he say about your leg that you can now move and function with?
Well, I told him about that, and he said it works. So he was very encouraging, and he knows about the KBlend. And so if you're going to a neurologist and mention it to them, maybe they know about it, maybe they don't. Mm-hmm. But the Mind Clinic, and he said, do it.
That's amazing.
Yeah.
And, we work with your providers if they have questions about the KBlend program, if they're not sure what it is. Not every provider is knowledgeable about what we do. So please give us a call, 734-605-8500. Now, Leroy, have you been to any physicians who have seen how you're now functioning, the level that you're functioning at?
I've been to physicians, but usually they're just taking my blood tests and things like that for my diabetes.
Okay.
And they have never mentioned anything about they want to push the pills on me for my arthritis and stuff, but I haven't been taking them.
Yeah.
And it's been it's great.
Yeah. Now, a daily pill that you have to take, oftentimes you have side effects.
Mm-hmm.
Do you have side effects from the KBlend program after a treatment? Do you have any side effects that you suffer from?
Nope.
Okay. Susan, do you have side effects?
Just extreme energy.
Well, praise God for that.
Yeah. Energy. And after I have it done, it's like, okay, I can do this, this, and this before dinner. And I can do this, this, and this after dinner. I get a big boost.
Yeah.
From doing treatments.
Yeah. And your mom's probably just sitting there with her head spinning, watching you run around the house, getting all those amazing things done.
She's actually amazed. And when I come home, she said, "Where were you?" And I said, "I had a treatment." And she said, "Good, you need that." And I'm like, she doesn't hold anything back. She's like, "Yeah, you need it, honey." So I love my mom.
And now you have a large puppy. Right?
She's now 3
years old.
And she's a very big standard poodle.
Yeah.
Yes.
So how does she react? Does she react any differently from before treatment to after treatment when you get more positive, more excited, and that energy is there?
Oh, she loves it.
She loves it.
Yeah.
Dogs are very intuitive. They know when you're in a good mindset, right?
Yeah. She knows and takes full advantage, backs up to me and her heads me so that I pat her and
Amazing.
Yep.
So what's next for the two of you? I mean, you've been through the KBlend program. You're continuing to get treatments every so often to keep that maintained, your chronic pain maintained. What's next, Leroy, for you? Where do you see yourself going? Are you able to travel? Are you going on vacations?
Matter of fact, I'm going on a cruise coming up March the 5th.
Okay.
And I'll be gone for 8 days.
Okay.
And I'm going to enjoy it.
Yeah. Do you feel confident that you're going to be able to do things and do excursions and move around the ship okay?
Oh, absolutely.
Okay. Susan, how about you?
Just every day right now. Trying to get everything all organized and put in place and do the catch up that I should have done this a long time ago. Yeah.
Gotcha. Yeah, I understand that for sure. So if there's anything that you want to say to someone who's listening about the KBlend program, maybe they're discouraged in life. They've tried many different treatments out there, many medications, seen many doctors about their chronic pain. Leroy, what advice would you give to them right now?
Well, anybody that's in the construction business, I would tell them you do get depressed when you're doing work or if your jobs are not coming in or anything like that. And I know people that's in construction has pain.
Yeah.
And they need to come in and see you and at least get the vitamins, if nothing else.
Yeah. Susan, how about you?
I would say pick up the phone and you're going to have some new friends. If you are dealing with depression or hesitant, pick up the phone and talk to some people that want to help.
Amen.
Yeah.
So again, if you're listening today and you have any questions about what was shared during this radio show, our KBlend show, please give us a call, 734-605-8500. Surely you or someone that you know is suffering from chronic pain or a mental health condition. And again, that could be depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder, suicidal ideations, or self-harm. We can help. We have helped over hundreds of patients deal with these chronic conditions, patients who are struggling just day to day. Again, whether it's from chronic pain and being able to get up out of bed so you don't have that hunchback, Leroy, like you discussed, or maybe it's suicidal ideation. Susan, as you identified with trauma, it's very common to have suicidal ideations as you go through trauma. KBlend can help you. please give us a call, 734-605-8500, or visit us at our website, www.mykblend. That's the letter K, BLEND. We are here to help you. There's no obligation.
For years now, you've listened to testimonies from other WMUZ listeners about the miraculous effects of KBlend on
PTSD, I'm bipolar, I have anxiety, I have depression.
I was actually diagnosed bipolar. There was a time I was taking probably 30 to 45 pills a day.
I've been dealing with depression for about 2.5 decades. Depression and anxiety. I've been in and out of hospitals, and that's usually because of a suicide attempt.
But you're still suffering. Don't wait any longer. With this special offer from KBlend, now is the time to contact John and Krista at 734-605-8500.
There were a lot of nights where I would go to sleep and I would just hope that I just didn't get up the next day, to be honest with you.
I've tried pretty much everything that you could think of. I was diagnosed with severe depression, severe anxiety, bipolar disorder. I wasn't able to do daily tasks. I would just lay in bed for days. Definitely has not just changed my life, but saved my life.
KBlend acts like a sledgehammer on treatment-resistant mood disorders like suicidal ideation, anxiety, depression, OCD, PTSD, and on chronic pain.
I started noticing a difference even just after the first treatment. After the third treatment, it was a very, very big difference.
Break the chains of your mood disorder or chronic pain and get real and lasting relief with KBlend. Get on the road to real recovery by calling the Helpline at 734-605-8500.
Welcome back to the KBlend Show. I'm John Klyder. I'll be your host for this next segment. We're actually bringing in Susan's husband today, and she's been talking about him, and now you actually get to meet this amazing person that she keeps talking about. So, Ken, welcome to the show. I remember meeting you when Jessie was in here, and she talks a lot about him. And so, can you just share a little bit about how you saw your wife coming through?
Yeah, it was, she felt better on the first visit, and that's always the placebo effect,
Right.
So you don't know for sure, but I think it was the third visit, but it was the second or third. She got home and, after the medication kind of wore off and she was back, she was in there talking to her mom who lives with us. She was just chattering and I looked at her mom and her mom looked at me and said, "We got our girl back." And that was as powerful of event as I can tell you. It's just like, holy cow, how did that happen?
My guess is a lot of it, she was probably just doing it naturally. She probably didn't even recognize what she was doing at first.
No, not really. But she did feel better. I mean, she said, "I feel better," but it was just kind of a random statement, But she had been fighting a long time, multiple different things from different directions, and it was just been really, really hard on really both of us, but her more than me. So.
This really is a family affair. I'm not the doctor here. I'm the guy that works out in the lobby with you guys, with the spouses and that. And what we've come to find is like working in the lobby is just critical as working in the back with the patients.
Yeah,
and just helping spouses know what recovery looks like. And I remember her very plainly, and I remember her just picking her feet up, and I didn't even realize how much she was shuffling her feet when I first met her until she stopped. And she's walking again. What would you say to somebody else is struggling with a spouse right now that it's probably going on a long time and you think this is just the life you're stuck in?
It kind of sneaks up on you. As it's sneaking up on her, it's sneaking up on you too. And you get limitations that are just one day you realize you have now, that you didn't have before. But it's like, we have a sailboat, and last year we went out, 3 times the whole year because she just never was up to it, and her balance was screwy and everything else. But it's just things happen, and all at once you're there, It's good that she has some other issues too that are mechanical things that's going to have to get fixed, and they're working on that. But from the neck up, there's been improvement. And it's remarkable improvement.
So did you think any of this would ever be possible for her?
Our friend that told us, about you guys, and I saw him change too, and I thought, okay, let's do this. Let's see what happens. And I'm sure that you hear that story a lot, that somebody else told me, because it's like, all right, what kind of snake oil is this?
That's right.
And then I saw my buddy, dear friend, I saw him changing in very, very positive ways.
Really an amazing story, because what you say is right. What we do here is so unbelievable. And a lot of what we do is very backwards from what people think it should be.
Yeah.
When you go into recovery, it doesn't always look like recovery. Like you have this imagination that maybe you're going to wake up like a 12-year-old.
Yeah.
Like you're just going to be better. And to even come to terms with what it looks like to get better can be very challenging. But the reality is you're getting your life back. So
100%.
what would you say to that next person that's just struggling? Like, the reality is you're sitting here, you've seen something change that you probably thought couldn't. And everybody makes excuses. And everybody convinces themselves they're special and they're unique. But what I have found is they relate to the way you were feeling.
Yeah.
And so what would you say to somebody that's kind of gone down that twisty road and found themselves somewhere?
I would never say, this will fix everything.
That's right.
But I would say it's worked for several other people that I know. And we're more alike than we are different from one another. The model that was used to make us in the first place is the same model for everybody. So I think it can help. Years ago, she'd had a stroke, actually a series of strokes. And everything she wanted to do, she couldn't, and
well, Ken, I can't thank you enough for taking the time to just share with our audience today. Our goal is to get people to come in before it gets so bad. But unfortunately, many people won't even come to us until they're at the end.
Yep. Last chance, nothing left.
That's right. That's what a lot of people do.
Yep.
And, we can still reach them at that point.
Yeah.
But there's really no reason people have to suffer that much. Well, thank you for everybody coming in and tuning in with us today. My name is Krista Klyder. I was the director of the program here. If you have any questions, you're welcome to call us anytime, 734-605-8500. And our website is www.mykblend.com. That's MYKBLEND.com.
Bernie was struggling.
Daily life was just so difficult. Cleaning, missing appointments, canceling. And I wanted to do things, but just couldn't seem to do it.
No matter what she tried, nothing seemed to help.
I went on different meds and counseling, psychiatrist, psychologist, just doing a lot of different things.
She had just about given up when Bernie decided to call KBlend at 734-605-8500.
I called that number, and after talking with John, hope was in my heart, and I really was so thankful.
Bernie started KBlend treatments and finally got the breakthrough she was praying for, because KBlend acts like a sledgehammer on treatment-resistant mood disorders like depression, anxiety, PTSD, OCD, even chronic pain.
I just believe that KBlend for me was that next step of giving my life back.
Call the KBlend helpline at 734-605-8500.
I would encourage you to call KBlend because it is a game changer.
I thought it was normal that I couldn't feel happiness. That was just something I could never feel. Like some people, they place their hand on a hot stove and they don't feel the pain. They can't feel pain, I can't feel happy.
Jill had tried so many things to get her depression and anxiety under control, but nothing was working. And the situation was dire because
I had a suicide attempt 4 times a year. It was like with the seasons.
Then Jill heard about the miraculous effects of the KBlend program. But she initially thought
that it's not going to work. I've tried everything. This isn't going to work. And I was proved wrong.
KBlend works like a sledgehammer to break the chains of treatment-resistant mood disorders like depression, anxiety, suicidal ideation, PTSD, OCD, and more. And how did Jill feel after her KBlend treatments?
It actually works. I actually feel happiness.
Don't waste another moment fighting your mood disorder and failing. Call the KBlend helpline at 734-605-8500 and talk with a KBlend specialist about how this amazing program can help you. You've been listening to the KBlend Show with your hosts, John and Krista Klyder. Thank you for joining us. You can find out more about this revolutionary treatment at mykblend.com, or you can speak directly to a KBlend expert by calling 734-605-8500. And join us each Saturday afternoon at 1 for more honest stories of healing and hope with the KBlend Show on 103.5 FM WMUZ The Light. Detroit made, Bible strong.